एक नया एहसास जिसे मैं शायद बयां ही नहीं कर सकती। तुम हो वो एक खुशी जो मुझे पूरा बनाती है। जानती हूं मैं कि बदलते वक्त के साथ बदलेंगी तुम्हारी जरूरतें। माँ तैयार है तुम्हारी हर उस चीज के लिए जो तुम्हें आजीवन स्वस्थ रखे।
A healthy mother means healthy child. Every woman deserves a care during pregnancy. Good nutrition, regular health checkup, and timely medical support can save both mother and baby. Let's come together to ensure safe motherhood and healthy future generation. In contrast to the same, we have series of episodes on the maternal and fetal health. Today we are joined by Dr. Neeraj Kumar, a distinguished medical scientist and doctor of philosophy in the clinical biochemistry from Madhepura, Bihar. Dr. Kumar currently serves as a managing director at Medipath Diagnostics and Research, and he is a research head at Naydu Medicare and Research Center. His research span several vital areas in clinical biochemistry, and he has published influential studies on gestational diabetes disease in Koshi region, hypophosphatism, and chronic diabetic patients. At present, Dr. Kumar is a leading government approved research center awareness program processed before the Government of India under the Panchayati Raj Department, focusing on the ensuring healthy childbirth through the active community engagement. His research journey is deeply personal, dedication to loving memories of his grandparents, late Shri Ram Charan Singh and late Srimati Gula Devi. He draws inspiration from Mr. Babban Singh, retired MD, Coal India, as well as Dr. Asim Prakash and Dr. Naydu Kumari and Dr. Neha Kumari, who have each played a meaningful role in his shaping up scientific visions. We will truly honor to have Dr. Neeraj Kumar with us to share his insight, experience, and research perspectives on importance of maternal and fetal health, with a special focus on HELLP syndrome and clinical significance. So, welcome, Dr. Neeraj Kumar, and we would like
Thank
to
you.
have insight from your side.
Okay, let me first congratulate you and your team for organizing such a program as your social, corporate social responsibility. And many thanks to all of you for having me with this program.
Thank you so much, sir. So, we from Trivetron welcome you on this particular podcast session. Before starting, I would like to have something from some insight regarding your involvement into this particular crucial segmentation. Government of India is also focusing on this particular activity. So, would like to have an insight from your side.
See, thank you. Very good question. Maternal health is a very significant issues in the society, more particularly in the rural area. And when we are talking about maternal and fetal health, we are talking about so many things. Like we are talking about the occurrence of miscarriages. We are talking about the bad outcome of pregnancy, like low birth weight, stillbirth, and babies born with certain genetic and chromosomal anomalies, chromosomal defects, babies with several diseases after they got birth. So there are many of things which has to be related with this maternal and fetal health, and more particularly when we are talking about this, one of the major reason that I have seen is the case of preeclampsia and the eclampsia, which in advanced stage reaches up to the HELP syndrome. But according to me, that HELP syndrome, I think, in my personal view, is a very distinct syndrome. But generally, in the society, in the fraternity of medical society, people generally consider it as an advanced and worst stage of both of this pre-eclampsia and eclampsia. So not only this, when we are talking about maternal and fetal health, we are talking about certain syndrome which cause the disability after
Yes.
the birth, like Klinefelter syndrome, like Turner syndrome, like Down syndrome, like Edwards syndrome, These are the syndrome which has happened due to the chromosomal anomalies. So what I would say at this juncture, because see, we have developed a lot since independence. There are many things which has happened in course of journey of the medical advancement in our country. And at this juncture, I would like to say here that the early diagnosis of all these pathologies has to be take place for the prevention of all these mishappening regarding to the maternal and fetal health linked with the morbidity, I can say, and a mortality rate of both mother and fetus.
As we are discussing about the syndrome, so would like to know about what is HELLP syndrome.
HELLP syndrome is a advanced stage of preeclampsia and eclampsia. Somehow it can be considered as a distinct syndrome with a distinct kind of manifestation of the clinical symptoms with this syndrome, like
Understood.
nausea, vomiting, upper abdomen pain, neck pain also, and might be with fever or fever-like feeling. Okay, and
Got
it
it.
might be life-threatening, and it cause the multi-organ failure if it is progressive.
Understood. So, sir, since we are talking about all the investigations which are required to be done, in contrast to the same, I would like to know what is the chromosomal abnormalities and what are their adverse effects.
With the formation of embryo, there is a chromosomal setup of 46 chromosome, 26 each from the mother and 23 each from the father. So if there is a exceeding number of chromosome with the father or mother, or if there is a rearrangement of the chromosome, if there is a dissimilarities in the arrangement of the chromosome, and if the number is dissimilar, then it arises as a chromosomal defect during the pregnancy.
Okay. So, can you just give me little highlights about how the preeclampsia and eclampsia can be diagnosed?
So see, preeclampsia and eclampsia can be diagnosed with the onset of their symptoms. That I have told you is the persistent hypertension with protein in the urine with additional symptom of seizures. So if we would like to diagnose it very early, we will have to apply two parameters, which is proteins, and they are known as, one is SFLT1. It is SFLT is a short name. Virtually, it is soluble like FMS tyrokinase 1. It is a anti-angiogenic marker, and the
Okay.
second is placental growth factor. In short, it is PGIF. Is a pro-angiogenic factor. So both this eclampsia and pre-eclampsia is caused by the poor angiogenic factor. So if we will determine the value of this pro-angiogenic factor and anti-angiogenic factor with a ratio, we can easily diagnose it too early, as we are diagnosing currently in the 6 or 7 months. So we can diagnose this case in the 13th to 15th week of pregnancy itself.
Just wanted to understand which are the lab investigations which are recommended and what are their analysis criteria.
For FLT and PGIF?
Yes. Yes, sir.
Yeah. See, as I told you, SFLT is anti-angiogenic markers. So in case of adverse condition, the level of SFLT will be elevated since it is an anti-angiogenic marker, and the level of PGIF will be decreases. It will come with a low value as it is desired. If there is no imbalances, if the ratio of SFLT1 and PGIF is adequate and correct, then there is no any problem. Generally, in case of adverse situation, the SFLT levels goes higher and higher. Okay. And the PGIF level goes down and down. So if there is a imbalances like that, the adversity is largely expected. If there is no any imbalances seen under this, no adversity can be expected.
Sir, just wanted to understand what is the early diagnosis?
Eclampsia.
Yes, sir.
We are talking about eclampsia, or we are talking about HELLP syndrome?
Sir, HELLP syndrome also, and then later on followed with eclampsia and preeclampsia.
The HELLP syndrome is expected in the 27th week of pregnancy. So there are several tests. First, we have to go with CBC. If we'll observe that there is a low HCT level, I mean hematocrit level is low, RBC level is low, and thrombocytopenia has been observed there, then we may suspect the case that the might be hemolysis is going on.
Understood.
So further we will go for the another test. Another test is like reticulocyte count. Reticulocyte count, if will be elevated, then it's again strengthen the suspicion that might be hemolysis is greatly going on inside in the body. So to confirm it, the haptoglobin is required. Through the haptoglobin value, if it is good, then the hemolysis cannot be expected. If it is low, I mean the level of haptoglobin is low, and if your HCT value is good, RBC value is good, reticulocyte is normal, even though if the haptoglobin is low, then the ongoing hemolysis is greatly expected, and you cannot be assured yourself that there is nothing wrong inside in the body. So hemolysis is one of the prominent phenomena which is related with this HELLP syndrome. So beside this, if the patient is with the onset of pre-eclampsia and eclampsia, a D-dimer positive result will confirm the case of HELLP syndrome. D-dimer. LDH is the another marker which will be elevated. Liver function will be elevated. So these are the conditions. Sometimes what happens, we are expecting always this HELLP syndrome prior to the delivery of the baby. But it might be happen within 48 hours of delivery also with the acute kidney injuries. So it is very unpredictable. Sometimes you are not aware that what is going to be happen. The mother may come with the HELLP syndrome and you are not aware. After delivery of the baby, and within the 48 hours, she may come with the symptoms of HELLP syndrome.
Got it. So, sir, in contrast to the same, I would like to understand the products which are being given to you, which are being used by you from Trivitron Healthcare, how it is helping you out in the mother and child diagnosis.
See, there are two products which I have told you. One is SFLT1. It is a anti-angiogenic marker, and PGIF. This is the another marker. It's a pro-angiogenic marker. With the help of these two, we can diagnose the case of pre-eclampsia as well eclampsia too early. See, generally, what has happened? The clinical manifestation of this pre-eclampsia and eclampsia takes place in the 7th month of pregnancy. In generally, more than 6.5 months after that, you can predict this. But here, in case of while you are using this SFLT1 and PGIF, you can diagnose the case too early in the 13th to 15th week of pregnancy. So see the differences of time. We can use the LFT marker, complete LFT marker like SGPT, SUT, alkaline phosphatase, gamma GT. All these LFT marker should be done at that phase. Along with the reticulocyte count, we have Trivitron 5D retic, which is facilitated with reticulocyte count facilities. And reticulocyte can be performed with that machine. And additionally, we may go with the D-dimer test also, as I told you. So these are the parameters which can be used, LDH also, that can be used for estimating all these or assessing all these situation in order to diagnose the case.
ट्रिविट्रॉन समझता है आपकी प्यार की परिभाषा करे एक खुशहाल शुरुआत।